My name is Shawn, and I am a registered nurse in Arizona. I've been a registered nurse in Arizona for 57 years. I've seen a lot of healthcare and a lot of changes in healthcare, and some are really for the better. We do so much better with technology, keeping people healthy and extending their life. We do some things more poorly. And I think that's where Navi comes in because we try to bridge that gap between the technology and the uh, impersonalization that's come to healthcare. And we try to remember that much in healthcare changed, but people are still the same. Healthcare is reimbursed for doing things to people. There are codes and reimbursement for procedures. Start an IV, change dressings, all those things are important. Uh, but the things that don't have a code are really important too. People need to understand what's happening to them. People need to understand that somebody really cares, that there's somebody that will listen to them, not just let them talk and wait till it's their turn to talk. They really listen. And nurses were educated to perceive patients as whole people. There's so much specialization in healthcare now. You not only have the eye doctor, but you have the retina doctor, you have the glaucoma doctor, so much specialization. And yet, people need to know the same things, that I'm going to be okay, that I have these instructions and I don't know what to do with them. Oh, now we had a Navi nurse who showed me the right way to do this care that the hospital said I wouldn't know how to do because here are the instructions. And I feel competent and cared for and heard. And that is what nursing does. They coordinate all the other caregivers. It's interesting that there is medicine and nursing for the last 100 years. And out of nursing came anesthesiology, pharmacy, physical therapy, occupational therapy, nutritionists. All these things were done by nurses 100 years ago. So nurses are still the hub of that team that cares for the patient and understands something about what everybody is doing. And that's so important. And that keeps the patient safe. And nurses also can recommend coverage for care that the patient didn't even know they qualified for. You know, you have to qualify for being sick these days. And nurses help us identify when there is something that the insurance company recognizes as a procedure. So you probably can get it covered. Everybody knows, even healthcare providers, when it's about you, you can't hear as well. You don't understand as completely. So when you leave the hospital and you leave that very structured environment that is operating around you but not with you, and you're back in your home, and the nurse comes to your home and explains what those papers are that they gave you and which ones maybe don't even really apply to you and which ones you should pay attention to and how to do those things that you got the instructions, that is really important. Home is our safe place. And when we can get the care we need in that safe place, we get better faster. It's easy to see patients thriving once they get in their home environment. They can hear better. They understand better. They have questions. You know, when you're in the hospital, Sometimes you don't even know what question to ask. When you're at home, you've thought of them, there's someone there to hear your question and to consider what can be done to answer your question. Also, in the home, the family is there, and nurses see patients as a whole person and in a family. Those things go together. None of us are with totally alone. I know there are a few people who are really alone, but that's not common. Most of us have a partner, a brother, a mother, a sister, a friend, a close friend, and that person shows up when you're sick. So when you're at home with that person and someone comes in to do an assessment to see how you are, to look if your medications are correct, to look if you're on the right medications. Do the medications you were taking before you went to the hospital fit with the ones that they gave you to take home? It's a question. And now you're not only have the question, but you're ready to listen to the answer. Home is a safe place. Nurses enjoy working for Navi because they get to do what they were taught to do. Late in my career, I became the director of a school of nursing, and I taught people how to be a nurse, how to think like a nurse, how to act like a nurse. And when you get into the hospital, a lot of your energy is put into the hospital and what the hospital needs, and that's fair enough. That's fair enough. But when the nurse is in the home with one patient and is focused on that one patient, they get to do nursing like they were taught. You know, our current home health system is driven by reimbursement. I can give you an example of a patient that we had who went home with IV antibiotics, not uncommon. He needed to give these antibiotics to himself twice a day. So he got 2 home health visits. One for them to show him how to do the injections, prep the medication, and one for him to demonstrate that back to them. Well, the only problem was that this patient and his wife were 80 years old. When the Navi nurse showed up to take care of them, they had a magnifying glass trying to see the syringe and trying to decide, is this the right amount? Am I doing this right? Am I going to hurt myself? What's going to happen here? And what the Navi nurse was able to do was assess the situation. That's the patient, the family, the environment, and everything. And with the patient and his wife, developed a co-created plan of care for the patient to provide this medication. So the nurse came in the morning and gave the first dose and put the second dose in the syringe, measured it, had it all ready to go, and the wife gave the medication in the evening, and they felt competent. They felt they were in control of this situation, that they were doing okay. And that is an important piece. As we move more and more of the patient care to the home, it's more and more technical. Oh, sometimes it's simpler, but a lot of times they've only figured out how to provide you with the things that you need to do this care that somebody used to do in the hospital. And so what is needed now is a cadre of nurses that can go out to the home, show them how to do it, validate with them that they are doing it correct, and encourage them that they are in charge of what's happening. They are not just a bystander to what is happening to their loved one or to themselves. So this is a whole area that really needs to expand and to be built up to support the plan to move a lot of hospital care to the home. I would want them to know that there are nurses that they can hire to come into their home and help them get acclimated to their new situation, to help them um, do all the things that the papers that they got from the hospital said that they were able to do. And I would advise them to call a nurse. If they don't know if the medications they were on before they went to the hospital are still appropriate with the list they got coming home, call a nurse. I will say that as Navi goes out and helps people get acclimated to their home, we find that almost all the patients need what we call medication reconciliation, looking at the medications they had before, what's in your medicine cabinet, and the medications that have been recommended and maybe already picked up from the pharmacy for you to take now. And you know what? They are different colors and different sizes, but they're the same thing, maybe. Maybe you were taking high blood pressure meds before you went to the hospital, and now you have another one, but they're a different name. It doesn't say on the bottle what they're for. You don't realize that you're taking two high blood pressure medications now. So that is so important. If you're confused about the medications that you have and the new ones, call a nurse. That's what I would want the public to know. A nurse can help, and there are nurses ready and available, not only to help you in the instant, but then you know that you have a professional to fall back on. I had a stroke about 2 years ago, and my family needed to be away for the night. And I said, I'm fine. I'm okay. And that did not reassure them. They weren't sure if I was stupid or being brave or what. And I said, why don't we have a Navi nurse come and check me out, and then they can talk with you and you'll know whether or not it's safe to leave me at home at night. So I did have a Navi nurse, and she was so personable. She understood right away what was needed. She discovered very soon that I didn't need a nurse, but my family did. And the nurse told my family I was perfectly good to be on my own, and should I have problems while they were away, she was available. She personally would make herself available. That was such a wonderful experience for my family and for me, because I could see, I told you so, and they believed me now.